Hi, my name is Lydia Mason, and this is my research proposal. So I'd like to start by just telling you a brief story. So throughout my life, I endured a significant amount of trauma and sexual harassment and assault. When I was 16 years old, I was raped by my then boyfriend, and because he did not use protection, I was forced to go to Planned Parenthood and get a pregnancy test. That was one of the most traumatic and nerve-wracking moments of my entire life. Not only because of what had happened to me, but because I had the threat of being pregnant. And I wasn't just afraid because I could potentially become a preteen mother, but I was afraid that I might die. The United States has the highest rate of maternal mortality of any developed country in the entire world. In addition, Black women are 2 to 6 times more likely to experience maternal mortality than their white counterparts. Unfortunately, not much research has been done about why this happens. Even when things are controlled, for example, income, class, education, and health, Black women still have significantly higher rates of mortality in comparison to their counterparts. Currently, I work in a lab called Empower Lab, which does research on trauma and women's health. We recently conducted a study called Chronic Pelvic Pain, in which we analyzed over 1,000 different research articles that studied women's sexual health and pelvic pain. And of those thousands of articles, only 2 considered a woman's sexual trauma as a potential influencer of her chronic pelvic pain and sexual health. It's a known fact that sexual trauma can inhibit sexual functioning. I know that personally from experience. But there's also other statistics to show that stress can have a physical effect on the way that your body behaves. For example, Black women are more likely to experience physical weathering on their bodies in comparison to white women in response to stress. To me, this is a sign that we need to do research about how Black women deal with trauma can influence not only their sexual functioning, but their reproductive functioning when giving birth. Black women are more likely to display signs of preeclampsia during pregnancy, more likely to hemorrhage, and they're 3 times more likely to have fibroids than their white counterparts. These are all signs that on a basic level, Black women's bodies are not behaving the same as their white counterparts. While it is definitely true that there are disparities between Black women and white women in terms of their access to resources, medical assistance, and overall health, there's clearly a disparity in the way that they're handling stress and trauma. And because Black women are more likely to endure emotional, mental, and sexual abuse than their white counterparts, we need healthcare that is more competent in helping Black women deal with the trauma that they experience and pass down throughout their family. Due to the fact that there is limited amount of research that has been done on Black women's maternal mortality, I feel that we need to be more creative with the ways in which we try to tackle this issue. Previous research has found that even when things like education, income, class, and access to healthcare are controlled, Black women are still more likely to die in childbirth than their white counterparts. This signifies to me that we have to be more creative about how we try to solve this problem. And to me, this signifies that we need to start looking at factors like trauma, which have been shown to have a physical effect on the way that our body functions, specifically when it comes to sexual and reproductive health. For this reason, I would like to look further into my research question, which is how trauma and the way that Black women deal with their trauma can influence not only their sexual health, but their reproductive health as well. I would like to conduct this study by analyzing the pregnancy outcomes of women with varying levels and kinds of sexual trauma in their lives. Based on the research that's currently available, which is limited, It seems that even when things like education or income or access to healthcare are controlled, Black women consistently have higher levels of maternal mortality. This shows that something else must be going on. And in my opinion, I think it's trauma and the way that Black women are forced to deal with it. In addition to this, I feel that part of the problem is the way that healthcare providers are handling patients who have previous trauma, especially Black women. It's known that Black women tend to deal with and express their trauma in ways that are different from white women and women of other races. Because many healthcare providers are not trained to recognize the signs of this, they often miss the symptoms that Black women may be trying to describe to them. I feel that if healthcare providers can learn how to treat Black women in a more culturally competent way, they may be able to combat some of the symptoms and side effects of their trauma, such as higher rates of maternal mortality and sexual issues. I would like to further research this question by seeing how having different healthcare providers with different levels of experience with trauma-informed care can also help to improve a woman's pregnancy outcomes and sexual and reproductive health. Thank you for listening.